right. Hello, everybody. Welcome to today's session of Healthy Discussions. Before we get started, I just have a few housekeeping notes. The chat box and the Q&A feature are both open, so you can please feel free to use them throughout today's presentation. You can turn on subtitles, which are auto-generated by clicking the CC button on the bottom left corner of your screen. And today's session is being recorded and will be shared via Quality of Care NL's YouTube channel in coming days. I'd like to acknowledge that we're joining you from the ancestral territory of the Beothuk and that the lands on which Memorial University's campuses are situated are in the traditional territories of diverse Indigenous groups. We acknowledge with respect the histories and cultures of the Beothuk, Mi'kmaq, Innu, and Inuit of this province. We invite everyone to offer land or territorial acknowledgements in the chat and to take a moment to reflect not only on why we offer these acknowledgements, but also ways your life and work may contribute to decolonization and reconciliation. For those who aren't familiar with Quality of Care NL, we're a research and evaluation program based at Memorial University, aimed at improving social and health outcomes in our province. Healthy Discussions is a webinar series where we have quality conversations about health, healthcare, and social systems in Newfoundland and Labrador. Our goal with this webinar series is to engage with you on these topics with the aim of continuing public conversations during the ongoing process of health transformation in our province. Public discussion also contributes to the growth of a learning health and social system in Newfoundland and Labrador. On the screen right now, you can see a definition of a learning health and social system as defined by Health Accord NL in its task force report. This definition might seem a little bit complicated the first time you read it, but what it really boils down to is a health and social system that continuously improves through a culture of best practice, evaluation, equity, openness, and collaboration. The system learns and gets better, resulting in better care and health for everybody. Part of the definition states that individuals and families are active participants in all elements. So by engaging in sessions like this one, by being an active participant in your own healthcare and wellness, and by talking about and acting on issues that impact us as a society, you are contributing to a learning health and social system in our province. April is National Oral Health Month, and today our discussion is going to focus on the new Canadian Dental Care Plan that provides coverage for Canadians without access to dental insurance. So joining us today are Dr. Craig Smith, who is president of the Newfoundland and Labrador Dental Association, and Leslie Patey, who's the executive director of the Dental Association. And joining them for today's discussion is Dr. Robert Wilson, who's manager of Quality of Care NL. So Robert has some questions to get our conversation started, but as always, we'll be taking questions from the audience, which you can type in the chat or the Q&A feature. And since today's discussion is being recorded, you may wish to ask your question anonymously, which you can do by using the Q&A instead of the chat or sending your question directly to me rather than everybody else. So I'm going to stop sharing these slides and pass it right over to Robert to get us started with our first question.
Perfect. Thanks, Melissa. And thanks to Craig and Leslie for joining us here today. Leslie, I'm going to get started with you. I'm going to basically ask the question, what is the Canadian Dental Care Plan and why is it needed here in Canada?
I'd like to say just thank you for having us today and asking us to be here. It's very exciting. The Canadian Dental Care Plan, also known as CDCP, is a federal government initiative aimed at improving access to dental care for Canadians who do not have dental insurance and have an annual family income below a certain threshold. It is a publicly funded plan introduced by the Government of Canada to address the gaps in dental care coverage, particularly for low and middle income families. Why is it needed? High cost of dental care. Dental services in Canada are not covered under the Canada Health Act, meaning most people must pay out of pocket or have private insurance. This creates a barrier for many, especially those with a lower income. Only over 1/3 of Canadians do not have dental insurance. This leads to many people avoiding or delaying necessary dental care due to cost. Poor oral health is linked to a range of serious health issues, which Dr. Smith will cover a little bit later on in this discussion. Improving access to dental care helps reduce healthcare costs in the long run by preventing more severe health problems. So government wanted to find a way to make sure all Canadians have access to oral health care.
Perfect. Thanks, Leslie. So, Craig, I'm going to pass it over to you. Leslie obviously touched on a few criteria of who is eligible for this plan. Besides that sort of low income for seniors, who else would be eligible, and how, if for those who are eligible, can you perhaps touch on how one would apply to this new plan?
Perfect. Once again, echo Leslie's thoughts. Thanks for having us here today. So yeah, the criteria for applying for the new Canadian dental plan, the overarching criteria, the one Leslie mentioned, is you have to have no access to dental insurance. That includes if you had it and you canceled it, you can't then apply to the Canadian dental care plan. If you were offered dental insurance, you're actually void from being able to get this dental care plan. You do have to file a tax return and be a resident of Canada in order to qualify. It is administered through the CRA. And you have to have an adjusted family net income of less than $90,000 per household. So the whole household income has to be less than $90,000. The process to applying, there is an online portal with Health Canada. There's a 1-800 number. We will have a QR code at the end of this particular presentation, a slide that will have all those details on it, so the participants can scan, and you'll see those websites and the 1-800 number right away. So presently, who's able to get it right now? Currently, we have our age 65 and older demographic that's able to avail of this Canadian dental care plan. Those children under the age of 18 are also able to apply right now. And anyone with a valid disability tax credit is able to apply presently. Starting in May, so in just a few days, on May 1st, the age group between the ages of 55 and 64 will be able to, right up to 65, will be able to apply. And then quickly on May 15th, that will change from the 18 to 34-year-olds will then be able to apply. And finally, at the end of May, May 29th, everybody will be able to apply. So that includes the last group, which is the 35 to 54-year-olds. So May is a busy month. By the end of May, all participants who are able to avail of the service will be able to apply. Now, one of the things that's important to remember is that once you apply, there is a wait period to getting the documentation back from Sun Life, who is the administrator for the plan from Health Canada. So there will be you not necessarily be able to get dental care until you actually get the card and the information from Sun Life.
And just sort of a side question on that, Craig, like, do you know how much of a lag time, or do you have any indication of how long it usually takes for once they apply, how long it will take for the next?
Well, the initial rollout started last year, and it was done much slower than what they're proposing to do it right now. So it took us a fair bit of time to get to we're about almost 3 million people are eligible to receive a plan right now, but there's another close to 5 million people that will be able to, or 5.5 million that will be able to get this plan starting in May. So I don't have the hard facts numbers, but back then when it was taking about a month to 6 weeks, but I suspect it may be slightly longer because of the sheer volume of people that will now have to be processed and done. And the other thing to remember is that every year you have to reapply. So those people who got it last May are now back into the renewal process, which is handled by the same department, same office. So that those 3 million people are about to come back for renewal back around the second time. So those people will go back into the queue as well, waiting to get their renewal process done.
Right. Okay, perfect. Leslie, I'm going to go back to you. I know all dentists is a private clinics and stuff like that. So with this new plan, do all dental care providers accept this new Canadian dental plan?
In Newfoundland, I'm going to say it's about over 92% of our dentists accept the plan. It's very important when you call the office to ask the question, are you accepting CDCP insurance? That's a very important question to ask when you call a dental office. But yes, majority of our dental offices are accepting new patients and this plan as well. And to find a dentist, you can go to our website, which is www.noda.net, and you'll be able to find a dentist there and to point you in the right direction.
Perfect. That was my next question. So you took the words right out of my mouth. Melissa, I'm going to just see if there's any questions coming in from the audience before I move on.
Sure, yeah. I have one question, and Craig touched on this a minute ago. Someone wanted to know how to register for the new plan when it expires, when their current coverage expires in June 2025. So I assume this is someone who was eligible to apply last year, and they're coming up for renewal now. Is the renewal process does it take as long? I guess we wouldn't know really, because this is everybody's only coming up for the first renewal just now. Is it, I wonder, is it the same kind of process? Do we have to kind of reapply from scratch again, or is it a more simple, they're just looking at your tax return again for the most recent year when you renew?
So I do know that all the participants who currently have CDCP are getting a letter from Health Canada and Sun Life directing them to the process of how to renew the application. So there's a letter that went out to everybody who had CDCP last year, telling them they have until the 1st of June to reapply, and coverage ends the end of June for the first year, right? So you need to renew that coverage for then. You do have to resubmit your notice of assessment along with that. But the process and how long that's actually going to take, we really don't have any information on that yet, of course, because as you just said, it's brand new to everybody, right? So we're sort of learning as we go here. So whether it's going to be the same amount of time to do a renewal as it was to do a new application, my assumption would be that it wouldn't be, because they would have some of the information already, but I can't say for sure hold that question until next April.
I just put in the chat a link to some information on the Government of Canada website about renewing your benefits. And like you said, it'll be really helpful for current plan members to get their reminder in the mail about renewal. Yeah. Someone just commented that their father received a reminder on their renewal in the mail, so that was good. One more quick question, Robert. Someone asked about the criteria of what's being covered under the CDC plan. Specifically, they mentioned dentures and that type of care not being covered under the CDC plan. Is there some criteria listed out there where we can understand what type of services would be covered? Anybody have any ideas?
That was our next question.
That was the next question I think you were going to ask about what's covered.
So the coverage, so I'll start with the basic dentistry is covered. So the things that you would be accustomed to having done at the dental office, basically. So exams, cleanings, x-rays, any fillings, things like that are all covered without any additional paperwork. They will allow extractions as well to have teeth removed. We can do some root canals without having to do any extra paperwork. Your question about dentures. So complete dentures are covered without having to do additional paperwork. Partial dentures, so ones that patients that still have some teeth and only need certain ones replaced, those do require additional paperwork. So they didn't start covering those till November. There has been a fairly big backlog in the number of those that got submitted to Sun Life for approval. So we're just now starting to they're just trickling in now, the approvals for those since November. So it's taken about 4 months or so to get an approval through. They are working hard. I understand for Sun Life, they are trying their best to get through these. They were a little overwhelmed by the amount of these that came through in a short period of time. But yes, so complete dentures, no problem. We can do those, come in, get them done without any issues. But partial dentures, there is a separate process that dental offices have to go through to get those covered for patients. So there is a delay in getting those done.
I see. That is good to know, though.
Okay, so Craig, you in our previous conversations, you basically mentioned that perhaps what is covered is quite a complex system. Right. So I know along with this perhaps you have a slide to demonstrate. So perhaps you could walk us through an example of someone coming into a dentist's office
Okay.
for something, and perhaps just walk us through what is covered under
Okay.
certain plans.
That'd be great. I'd be a pleasure to do that. So the plan, not only, it's not sort of just cut and dry that you come in and you have a certain level of coverage and all that stuff. So they've created a tiered system so that people fall into one of three categories. You either make less than $70,000, you make $70,000 to $80,000, or $80,000 to $90,000. And what bracket you fall into will depend on the amount of coverage the government is willing to provide. So that's one aspect of this. The other aspect, and this is a busy slide, I'll try my best to walk through this. There's a lot of information in this, and I apologize if we get down in the weeds here a little bit, but it's important that sort of people understand where we are with this. The other thing the government has done is that they've created their own fee schedule. So dentists, by their very nature, because we're independent, our fees are not regulated. We're able to charge what the market will allow us to charge. So our associations, including the NLDA, produces a suggested fee guide for practitioners so that people have an idea of roundabout what things are being charged for, but that's not mandated. Each dentist can change that fee guide or fee schedule as they see fit. The federal government, with this particular plan, has done a fee guide that is set. This is the amount we are paying. This is all we are going to pay for a particular service. In general, those particular fees are about 80 to 85% of our suggested NLDA fee guide. So for argument's sake, we'll say there's roughly a 20% reduction in the suggested fees in what the CDCP is going to pay. So that is one aspect of this. So that difference between what the NLDA fee guide, suggested fee guide is, and the CDCP mandated fee guide is a term called balanced billings. And we'll go through some hard numbers here in a second. It's easier to understand maybe with some hard numbers. The other aspect of this, and this is where we're getting to the categories, so the people who qualify with less than $70,000, they are covered at 100% of the federal government fee guide. So whatever the government will pay, that they'll get 100% of that. So if they pay $80, they get the full $80. Those between 70 and 80% will only get 60% of the government fee guide. So there's a 40% copay that the patient has to pay. We are mandated to collect that as a dental office. We accept this plan, we have to take that money from you. If you qualify between the 80 and 90% bracket, the Canadian Dental Care Plan will only pay 40% of their fee guide, and the patient is forced to pay the 60% of the fee guide. So let's just break this down into sort of hard and fast numbers here. So if we were to go into, now these numbers, just so everybody's clear, are not fees or anything else. These are just, we picked these numbers because they're easy numbers to understand. So if you went to a dental office and your bill was $100, so you had an exam, you had 2 x-rays, and you had three x-rays. One of them cost $25, 2 of them cost $25, and the exam cost $50. So that's what you see there and we just used 2023 because that was the first year that it came out in place. So we're just taking those numbers so patients can understand. If you look to the right of that column, what you see there is what the Canadian Dental Care Plan fee guide would pay for those same amounts back in 2023. Okay, so we're about 82%. So you see that there's an $18 difference between what the Newfoundland Labrador suggested fee guide is and the CDCP fee guide. So we move to the bottom bracket. What you see there, so patient A comes in, they qualify in the less than $70,000 bracket, and this is on your card, by the way. When you get your card from Sun Life, it will say which category you are in. Okay, so line A, less than $70,000, they have no copay, so that's the first category. So there's nothing to suggest that they need to have any money paid. So they're going to get 100% of the CDCP fee guide. However, there is a balance bill to the patient, which is the difference between the Newfoundland Labrador suggested fee guide and the CDCP fee guide. So you move right over. What the patient pays is $18 and CDCP pays $82. That's, that's what they pay if you have 100% coverage. So if you have 100% of the CDCP fee guide schedule. You move to line 2, which is the second bracket, which is the $70,000 to $80,000 bracket. Now you have because they're only paying 60% of their fee guide, you have a 40% CDCP copay that you must pay, which works out to be $32.80. There's still the balance bill to bring it up to the suggested fee guide of the NLDA. So right now you're paying $50.80. CDCP is paying $49.20, basically half and half on that particular bracket. We move down to the last bracket, which is the one that's the $80,000 to $90,000 bracket. Once again, there's a copay on that. It is 60% this time, so it moves up another 20%. So that means the patient is obligated to pay $49.20. The same balance bill exists between the two fee schedules. Patient now pays $67.20 on the $100 treatment. CDCP pays $32.80 on that treatment. So about 30%, 32%. So the take home here, of course, and it's pretty obvious, the lower income will get more coverage. Obviously, the closer you get to the end of the income, so up to the 90,000, the less coverage you will receive from the federal government. So the only other sort of asterisk by this is that the balance bill part is voluntary. It is, some offices will charge that, some will not, okay? But every office must charge the copay. If you accept this plan, you sign a contract with Sun Life that says you have to collect that money. You cannot disregard that money. It has to be collected. Otherwise, you're in fault of the contract you've signed with Health Canada from a dentist perspective. So a little bit complicated. I realize there's a lot of numbers on this particular slide. It's a busy slide. We went through it a few times to try to get it down to where we thought it would be easy to understand. But certainly that there was some talk originally when this plan rolled out that everything was covered at 100%. There was going to be nothing you had to pay. Unfortunately, that does not exist. There's very few offices that are not balance billing or at least bringing it up to their regular fees. And of course, the co-pays existed even from the government knew that straight up when they were saying that it was 100%. They had these co-pays included in their original plan. So there is a fair bit going on with this as you get your card and figure out what it is you need to do. Dental offices are fairly familiar with this right now. So when you go into an office, we've done a very good job of educating our members on what this is all about. We've been using it for a while. So as we roll out to this much bigger demographic now, we do have the knowledge of how this works. So we'll be able to help you with that. But certainly any frustrations or any disappointments in this should probably not be directed at dental offices. This is not a dental office.
Absolutely not.
It's not a dental office problem and or plan. If you're not quite content with the way this works or isn't working, that's a call to your newly elected MP and figure out how to sort that out.
And I'm sure in this past year since this plan is rolled out, there's been a few patients that have been quite confused once they perhaps get that bill at the very end, thinking that 100% has been covered. Leslie, I'm going to pass it over to you here now. We're talking about a federal program here now. Is there any existing programs within the provincial government within Newfoundland and Labrador? And to follow up, if there is so, how do two of these programs perhaps integrate with each other?
Well, there is. We have a few programs here in Newfoundland and Labrador. Our first one we have is a children's dental health program. So this is for any child in Newfoundland and Labrador with a valid MCP card, 12 years of age and under. So they will be covered, exam every 6 months, a cleaning once a year, fillings, if they need extractions, that kind of just basic stuff. That will be covered for all children in Newfoundland and Labrador up to the age of 13. So that's the first one. Another one we got is the income support program. This is for youth 13 to 17 years of age for families that are on the income support. What that will cover is your basic services every 2 years, fillings, exams, and if they need a tooth removal as well. We have a low income access program. That is for youth ages 13 to 17 years of age who are eligible and are enrolled in the access plan of the Newfoundland prescription drug program. Again, that covers exactly the same as the income support program, fillings and exams, x-rays, or if they need a tooth extracted. We also have a surgical dental program. This is a medical necessary surgical dental services that need to be done that will be covered under the MCP. They are sent in by the dental office to government, and then they will be evaluated by the dental monitoring committee of MCP. We also have a dental adult program. This program covers basic services of exams, x-ray, fillings, tooth removal, and dentures once every 8 years. So if right now any child under 13 should be seeing a dentist at least once a year, which
Right.
we hope. They can also use, if they have CDCP plan or if they have insurance, dental offices can bill the dental insurance and then MCP billing as well. We can bill both for this, for the MCP plan for the children.
Right. I mean, this it's a lot of information, and I know perhaps in the next couple of years with this, like as this new plan rolls out, people will get quite familiar with it and start understanding the grasp and you know, hopefully just take advantage of what is available to them. I'm going to start before I kind of switch lanes and start talking about oral health. Melissa, I'm going to toss it over to you to see if there's any questions coming in from the audience.
Yeah, sure. We have a couple coming in here. Mike had a question. He said he chairs a seniors group, and many members in that group are having an enrollment issue with the CDCP, and they're wondering if there's an appeal process. I guess if you were denied coverage, if there's a way to appeal.
They should be, if in the letter, if they get denied, it's usually there's a reason of why they're being denied, and there should be a number that they could call to ask the question. Of course, if they don't get anywhere, they can always call the association and we can try to help any way we can. Absolutely. That's what we're here for. But as far as I know, when they get a letter, it's explained in the letter of what's the reason.
That's good to know. And there was one question someone just wanted to double check. They said their mother is 78 and pays private insurance, which only covers preventative services, cleaning, checkups, etc. The federal plan covers much more. Can she cancel that private insurance and apply for the CDCP?
That's a very gray area. So they haven't really said no to that, but they haven't really said yes either. So it's a really, really sort of tricky one to get around. So if the private insurance is through previous work employment, you're probably not going to get coverage. But if it's private insurance that you went out, you retired, your benefits stopped, and then all of a sudden you went to a private insurance company and purchased insurance through them, there you may have a case there. But like I said, we're not experts in that. I don't know where to tell you to reach out. It's Sun Life may be able to help you with that. They have helped other patients. But yeah, that the whole premise was that if you had insurance, you would be exempt from this particular plan. But I have heard of other seniors who have gotten off their private after work purchased out of their own pocket plan and then been granted CDCP.
Right. Okay. Yeah, I can see that being kind of a gray, fuzzy area.
Yeah, very much a gray area.
Like whether you can afford private insurance on your own without through any kind of work. But thank you for sharing that. Probably Sun Life is the best place to reach out and see if you can get some solid answers on that one. Another question, they were asking about someone who's in post-secondary school, still eligible to be on their parents' insurance, but just for a short while longer. How does that work if someone's eligible to be on their parents' insurance plan?
For exempt. That's a simple answer. If you're eligible to receive insurance anywhere, that's the first criteria that exempts you from this plan.
Okay.
So even most universities would have a student dental plan. Almost all universities in Canada right now carry some. I mean, it might be a very, very basic plan, but just because of that, the sheer nature of having that offered plan, whether you opt out of it or not, that exempts you from being able to avail of the CDCP.
Okay, so if it's available to you and you can you're eligible to get it, then you cannot apply for the CDCP.
Correct. Even if
Yep.
you choose not to get the one that you're eligible for.
Right. So even if
You're
you're trying to
still-
get the better one, which is
Yeah,
CDCP.
you're still exempt. Yeah.
So
That's
the big thing
criteria.
is you have to have no access to dental insurance through work
Yes.
or through school or through your parents.
That is correct.
Okay. That's good to know.
How are we doing, Melissa?
You can keep going there, Robert.
Okay. So I'm going to get out of that sort of dental plan, insurance talk and switch lanes and start talking about a bit about oral health. And we know that it's important to our overall health and our well-being. And perhaps, in fact, what's happening inside our mouth can be an indicator of something that is actually happening within our body. So what can you learn about health status from, our mouth, our teeth, our gums, etc.?
Well, certainly what will echo what you said. Oral health is definitely overall health for sure. The mouth is sort of the window to the body, right? We can see into things that normally other areas of the body you may or may not be able to see through. So one of the big things we've learned in the last number of years certainly is that inflammatory conditions that we see systemically show up in the mouth for sure. And there's definitely a correlation between gum conditions and gum disease and very big systemic diseases which carry an inflammatory process as their basic stuff. So things like diabetes, cardiovascular disease, those type diseases are pretty prevalent in patients who have gum disease and go hand in hand together. And it's the inflammatory part that drives it, that sort of brings it all together. Diabetes is, and both diabetes and cardiovascular disease, very prevalent in Newfoundland for sure. It's one, we see tons and tons of that in our offices. We also see lots of cancers that will show up in the mouth. Oral cancers are above and beyond their own thing. We certainly look for cancers on all the oral tissues. They can be primary cancers of the oral cavity, but we also see particularly our bloodborne cancers like leukemia and lymphomas and things of that nature that will show up in the mouth. We see lesions sometimes that we don't necessarily know they're cancers when we see them. We're not necessarily experts in diagnosing the cancers, but we are experts in figuring out what's normal and not normal. And when we see unnormal things, we quickly get you to the people that need to see these unnormal things. We can pretty well tell when things are not good, but it's not sort of in our domain to be diagnosing either lymphomas or leukemias. But certainly, even in my own practice, I found 2 lymphomas in patients in my 25 years who didn't know they had it. But when we saw the lesions and got them biopsied and figured out what type of cancer they had, it happened to be lymphoma, which is not a cancer that shows, comes primarily from the mouth. Obviously, it's not a mouth cancer. So those type conditions are, the reason why we always encourage people to see, oral health professionals and get their annual checkups or biannual checkups done so that we can look at those tissues and things of that nature. The other things we see on a daily basis, obviously just general oral health things, broken teeth, bad dentitions that need to be repaired, things that affect eating, and even just a smile that isn't quite right, and people have a really hard social conscience with that when we are a very visual and very social society, and people who don't necessarily are somewhat ashamed of their smiles tend to avoid areas where they should be or shouldn't be, right? So that's it's important for us to be fixing those things and getting people back to their into their full mental capacity so that they can function properly and do all the things that they need to do.
Absolutely. And Craig, just out of curiosity, I just want to go back to you basically, recognizing some abnormal stuff in the mouth. So within that consult process where you say you will put them onto the right people, can you just kind of walk us through that? Like you wouldn't suggest to a patient that you should go see someone. Do you actually?
Oh no, we would do the referral. So within dentistry, we do have primarily we send them to our oral pathologists or oral surgeons. So both of those disciplines within dentistry are also medical doctors, and they are dentists as well. So usually that's the discipline that will start the process. If it's certainly if it's a cancerous lesion or a lesion that is not necessarily primarily from the oral cavity, they will get them off to the right medical people. Most of these folks have hospital privileges, something that most dentists don't have. Most of them will have, the ability to get people into the realm, into that discipline rather quickly. And I will toot our own horn. We tend to do it a little better than maybe medicine does it, because we can usually because most of these dental specialists also work in private practice. If I see a lesion that I don't really like, I can take a picture of it, usually text it to one of my oral surgeon buddies or oral pathology friends, and I can usually get a response back relatively quickly that we need to get this person in, within days. And it's usually not taking weeks or months to get people through the system. And that's not to say that medicine, they're just overwhelmed. I mean, we don't see the same number of lesions that medicine sees. But at the same time, if we do see something, I think we're pretty good at getting things done in a very judicious fashion so that we can get people sort of where they need to be
pretty fast, pretty rapidly. That's good. That's good to know. Leslie, I'm going to turn it over to you. We're obviously talking about oral health here and how important it is, but the fact is that there is a lot of people that have anxiety about visiting the dentist's office, just even getting routine cleanups. Do you have any tips for people who might be suffering from this anxiety about visiting the dentist?
Yes. The first thing is be honest with your anxiety. When you call to book an appointment, let the dental staff know at the front. Let them know that you're nervous, that you're anxious. Be honest about how you're feeling. They hear it all the time, and they're there to make you comfort. And it's good for them to know that beforehand, because they can make the notes of the dentist, the dental assistant, or hygienist know this beforehand. They have changed how they approach walking in the room, like little things that they can do beforehand, knowing this. The best thing, honestly, is book a morning appointment. You know what it's like waiting all day for that appointment, waiting. That's all you can think of.
Right.
Book early morning. You get in, you're done before the day starts, and then it's not on your mind anymore.
Mm-hmm.
Another one that helps as well, bring a friend. Bring someone that you can sit with you, that you trust, that can just talk to you, can take your mind off things, that kind of thing. That would help. During the appointment, some good things to do is bring your headphones, listen to music or a podcast so you can get away from hearing anything. Practice deep breathing. I would also suggest when you meet the dentist or the hygienist, using a system, raising your hand if you need them to stop, or if you need a moment, because you can't talk while you're in the chair. So it's good to have a little system with the dentist or assistant or hygienist.
Mm-hmm.
Ask questions. If you don't know something, they're there to answer everything to make you feel at ease. So ask as many questions as you have. And also you also got to remember you got to celebrate the progress. Even if you just book the appointment or make it through the door, that's a win. Anxiety doesn't vanish overnight, but we got to make sure every step counts. So making that first appointment, making that phone call, that's a win. So it's little things that make you over time will make it better going to the dentist, that your anxiety will fade.
Sure, and it's probably like, I mean, establishing a good relationship with your dentist and your dental hygienist is probably a good thing, right? And then just being upfront with those people and being honest that you do have this anxiety, and then they can work through that, absolutely. And just and I'm sure, like, I mean, everyone I've dealt with has the great bedside manner. I should actually take your basically your opinions on, for me, exercising in the morning, so that it's not on my mind all day and that I get it done.
I say we're going to do the early morning exercising, right?
Yeah. Melissa, before I continue on, I'm just going to ask to see whether or not there's any more questions popping up in the chat.
Sure. The chat's a little quiet right now. There was one follow-up question, and I'm wondering if maybe it makes more sense for them to follow up with you, Leslie, perhaps after the meeting. They're just back talking about the dentures coverage and the extra paperwork. They're just curious what extra paperwork is required for the coverage of dentures, and probably who has to, like, who fills that out, or can they get the ball rolling? So if we're not sure of that exactly, maybe we could.
I can answer that, Melissa. So
Okay, sure.
that paperwork is done by the dental office. It's a standard predetermination that we do for major work across all insurances. It doesn't, not just CDCP, but the CDCP one has very specific things we have to collect from the patient's mouth and the x-rays and things of that nature. So that extra paperwork is done on our end of it, not on the patient's end. We just
Okay.
simply need the patient to come to the office and we gather the information that they require.
Right. Okay, so then I would suggest having a conversation with your dental provider, your denturist. Just let them know the information that you learned here today. And if you have any other questions, like Leslie said, the NLDA is there for you to reach out to. I'm going to pop their contact information in the chat as well. So you can always reach out and ask some questions that way.
Absolutely.
Just a quick comment, Robert, in the chat. Cindy
Yep.
wanted to thank Leslie and Dr. Smith for coming to our Share Summit that we had back in November and sharing information about the CDCP and the NLDA and the new national strategy for oral health research. There's a lot going on in oral health in Canada right now. A lot of good things happening, and hopefully this can help facilitate what we need to make oral health more accessible to everybody in Canada.
It's important.
So Craig, I'm going to kind of stay on the topic of anxiety, and trying to manage anxiety is knowing what to expect. You don't want to be surprised by anything. So, when you walk into a dentist's office, you may encounter more than just the dentist. So perhaps could you kind of walk us through other members of your team and what are their roles within that office?
Certainly. So, of course, you are right, Robert. You are going to see a number of people. It's not just going to be someone like me sitting in a chair waiting for you to come through the door. So, the initial person you'll see, of course, is our front desk staff and our receptionist and administrative team that sits out front in the office by the waiting room. So they'll be your point of contact for all things to do with your dental appointment and anything else you have to do with the dentist, as far as any scheduling things you need to change, any billing questions you have. They're the people who are going to collect the money. They're the people who are going to get your insurance form signed. They are certainly going to be the people you're going to see on fairly regular, every time you come to the office sort of basis, for sure. They're going to be there sitting behind their computer and dealing with whatever, whether you call them on the phone or you come in person. The next person you're probably going to encounter is a dental assistant. These are the team members who will likely fetch you from the waiting room. They're going to be the ones who are going to be setting everything up in the room. They're going to be sitting right next to the dentist who is going to be doing the work. They're going to be responsible for all the sterilization you see happening, maybe may or not see happening, but you're assuming it's happening, and we're certainly doing a very good job on that regard.
Yeah.
So they're going to be the ones cleaning everything up, making sure you're seating. You're probably going to be spending some time with them when the dentist steps out of the room. They usually tend to stay in the room for the whole procedure, so they'll be chatting with you on a fairly regular basis. They're going to be chairside for the whole procedure, whatever you're having done. Unless, of course, you're having a cleaning done, and at that point, you're going to likely run into a dental hygienist. These are the people who do clean your teeth. They're also going to take a look around at all your oral health tissues and have a look and see what's if they see anything abnormal there that they may want to bring to the dentist's attention. You may or may not see a dentist every time you have your teeth cleaned, but certainly if the dental hygienist does see something that they think needs a look, they'll come grab a dentist for sure. And of course, finally, you're going to see someone like me who's going to primarily do the work that needs to be done in your mouth, whether it's a filling that day, just an exam, a consult, whatever we're doing that day, a crown, a bridge, whatever procedure we're doing that day is going to be carried out by the dentist. And then there's going to be a few people in the background that you're really probably never going to see, some office staff and some IT people that are going to be maybe wandering around the office, and you're sort of wondering what they're doing, but they're just there to keep the place sort of running and keep everybody in check. So, but those are primarily the 4 people you'll run into on an every appointment basis, pretty much.
Perfect. And Leslie kind of walked us through what someone personally can do to, not totally relieve anxiety, but perhaps help out with it. Could you perhaps, as a dentist, talk through some of the things you would do to relieve a patient coming in with anxiety?
Yeah, so it is a big thing, and the first and foremost thing is not to be ashamed if you are anxious. Lots of people will stay away from dental offices because they're really afraid to come in. As Leslie's already pointed out, all the things Leslie pointed out are great helping starting tools. Get you through the door, get you into the dental chair. Some people don't necessarily want to sit in the chair the very first time they come in. Maybe we're doing it from the desk chair, having a look. I tend to like to start with small things. Don't jump into big appointments if you're anxious. It's not where you want to start to. I do find that anxiety and trust sort of go hand in hand, and as you get more comfortable and used to somebody, the level of trust builds up, and all of a sudden you'll notice the trust goes up, anxiety goes down. So it is a sort of a one feeds off the other. So small appointments first, do some easy stuff. But one of the things I do want people to realize is that there are times where sedatives are required, and we do have the ability to sedate patients and give them medications that will get your dentistry done. And there should be no shame. You don't need to be ashamed if you want to come in and ask for a sedative. All dentists have the ability to be able to prescribe that. I use it on a fairly regular basis if I need to use it. Patients, we get through treatment. I do find that if I start off with sedating patients for their basic care, all of a sudden, once they get used to me and get a little bit of trust, I find they don't want to take the sedative as frequently for short stuff because there are some restrictions and things you can't do, drive and work and all that kind of stuff. But at the same time, there are some patients who just have that dental anxiety, and particularly around the needle part, needle phobias and things of that nature, that they take the sedative every time, and that's fine. That I know full well, and they know me, that they know. So it's that level of trust and being able to take that sedative, and then, like I said, not really being aware. You're not asleep, but at the same time, your anxiety decreases. You're able to get the care done, and everybody goes away relatively happy because you've had a relatively good experience. That you're not, your whole system isn't thrown out of whack because of the anxiety, right?
Yeah, absolutely. And I would imagine too, like, because the mouth is such a sensitive area that, a needle coming that way. In my day, I don't mind getting needles at all, but for some reason, obviously, when it comes towards getting in your gums and stuff like that, there's always my whole body will clinch.
Exactly. So
Yeah.
there is a general level of fear amongst almost all our patients when it comes to the needle.
Right.
So I don't see a whole lot of patients who are dead calm when I'm giving them a needle. That's just the reality of what we do. So, but those patients who have dentists certainly, and not to throw my predecessors under the bus, but certainly now we're very much aware of the real anxiety that exists about coming to the dental office, and we recognize that as a barrier to care. So we figured out ways to make that barrier less, be less than what it is. And if one of those things is pharmaceuticals and the use of sedatives, then so be it. That's now an accepted way of getting dentistry done if we have to get dentistry done, as opposed to just leaving it and not doing it till it absolutely, you have to go to hospital and get, half your teeth out or something like that. Nobody wants to get to that stage anymore, right?
Absolutely. And of course, like you talked about, just the importance of overall health for your, when it comes to your oral health. Melissa, that's all the questions I have right now. I'm just going to pass it over to you to see if there's any more chatter in the Q&A or any more questions coming in for Leslie and Craig.
Sure. I'm wondering if maybe we could just quickly touch on again what types of services are covered under the CDCP. There was just a question in there about implants coverage for seniors. So maybe if we could just have a quick review again of the types of services that are covered under the plan.
No problem. So the basic type dental services, like I said before, your fillings, your cleanings, your checkups, root canals do come under basic care. Fluoride treatments for kids, sealants, things of that nature, are all all going to be covered under CDCP. The major part of dental coverage, so that includes dentures, crowns, bridges, implants, as you just mentioned, are covered at certainly different levels. So complete dentures are covered without having to do any extra paperwork, what we call predeterminations. Partial dentures, crowns, once again, would require predeterminations. Implants are exempt. They're not, they didn't even put those on the list. So there's no, they won't cover those. So that's off the list for them to cover. So there are some treatments that the government has pulled back on that are off of the list is fairly extensive, but specific type treatments, best for patients to talk to their provider. We do have a list that we can provide, or it is available on Sun Life and Health Canada's website, the actual full detailed list of what's covered. But to answer your question directly, implants are not covered. So, but
That's good to know. Yeah, I mean, there's a lot of nuances and ins and outs on what is covered and how much is covered and how much a patient will have to pay and the different fee guides and all of that. So I think a good way for us just to summarize everything we've talked about, specifically around the CDCP, would maybe to take a look at the Health Canada website. I'm just going to pop it up on screen here now, just to remind everybody of when you can apply. So right now, adults age 65 and older can apply, as well as adults with a valid disability tax credit and children under the age of 18. And then throughout the month of May, starting on May 1st, if you're aged between 55 and 64, you can apply for the CDCP. On May 15th, those who are 18 to 34 years old can apply. And on May 29th, those who are aged 35 to 54 years old can begin to apply for the CDCP. And a quick look at the eligibility requirements again. You have to not have access to dental insurance. And we talked about this earlier, but you can click, what does this mean? And it'll take you down through all of the requirements for not having access. So again, if you have access through work, through your school, through your parents, and you're just simply choosing not to take that particular insurance, that makes you ineligible for the CDCP. So you'll have all of that information is there, and it looks a bit overwhelming, but if you just take some time to read down through it, it should be fairly clear. The second eligibility requirement is you and your spouse or common law partner, if applicable, must have filed your tax returns in Canada so that your family income can be assessed for the previous year. Your adjusted family net income is less than $90,000, and you are a Canadian resident for tax purposes. So if you fall into those age groups and other groups that we discussed on the last page, and you meet all four of these eligibility requirements, then you can apply for the CDCP and hopefully be approved and accepted into the program. I just thought it'd be a good way to summarize just the very basics about the CDCP and what your next steps are. But definitely, if you're coming up on to being eligible to apply, probably it would be a good idea to apply right away in that first week that you're eligible for application, just because you're not sure exactly how long it might take before coverage can be kicked in.
And Leslie, you said obviously the Newfoundland Labrador Dental Association is there for anyone who has any questions. And Craig, you emphasized that your staff is well educated and I would hope across all dental offices they're well educated within what this new dental plan has to offer and who's eligible and stuff like that. So don't be afraid to ask questions. Absolutely. Before I pass it over to you, Melissa, I want to thank Dr. Craig Smith and Leslie Patey from the Newfoundland Labrador Dental Association. Thanks for coming on and explaining this new Canadian dental care plan, along with talking about oral health and how important oral health is to your overall health. So without further ado, Melissa, I'm going to pass it over to you to finish things up.
Sure thing. I have on the screen now is a slide prepared by Leslie and Dr. Smith with some QR codes that you can scan to get some more information. There's also a phone number there because you can apply for the CDCP via telephone. You don't have to do it online. So that phone number is there on the screen. So some extra information there for you. But basically, that's all the time that we have for today's session. And again, thank you, Craig and Leslie and Robert, for leading us through
Thanks
a
for having me.
good discussion
Thank you
on
for having
today's
us.
topic. You're going to see a very short post-event survey on your screen after we end the webinar. So we'd appreciate you providing any feedback or ideas for future Healthy Discussions webinars. Thank you to everybody who joined us online to listen and participate in our discussion. And just a reminder that the recording for this session will be up on our YouTube channel in the coming days. And you can check out the recordings of all of our previous sessions there as well. So once again, thank you everybody for joining us, and we hope you have a great rest of your day.
Thank you.
Thank you.
Bye.